Hey guys, welcome to Nephro Nook. We're going to go over lupus nephritis and the 6 different classes. Each class of lupus nephritis is defined based on where the immune complexes deposit in the glomerulus. So let's just take a step back and go over the basic anatomy of the glomerulus. So remember, you have blood going into your glomerulus via your afferent arteriole. The glomerulus, let's just make that a little smaller. The glomerulus is just a bunch of little capillary loops, essentially a glom of capillary loops. They're little circles because that's a cross-section of your little capillaries. So you have blood inside the capillaries that goes across your basement membrane, this basement membrane, and goes into your urinary space, or your Bowman's capsule. That then goes into your tubules where a lot of the fine-tuning of your filtrate occurs. So this is your glomerulus. In lupus nephritis, you have immune complexes depositing in different areas of your glomerulus. So one area that this can happen, your immune complexes deposit, is just in the connective tissue that holds together these capillary loops. Another area is inside the capillary loops, which is a little bit more of a problem because it's right by the bloodstream, and another area could be on the outside of the capillary loops. So how do you define that? So with classes 1 and 2, your immune deposits are depositing in that first place that we said, inside that connective tissue holding together the capillary loops. That connective tissue is called the mesangium. So there are mesangial deposits. Remember, in light microscopy, you actually can't see immune complexes at all. You could only see them in immunofluorescence or electron microscopy. So with class 1, so you can't actually see any of these deposits for any of lupus nephritis on light microscopy. All of that to say is that you can only see the reaction to these immune deposits. With class 1 lupus nephritis, you don't even get a reaction to these deposits. So with class 1, your light microscopy is normal. You can only see these deposits in IF and in EM. With class 2, that's when you're starting to get a reaction to these deposits. So you start seeing an inflammatory reaction, otherwise known as mesangial hypercellularity. You're just getting more cells around here. So you're seeing a lot more cells around here. So mesangial hypercellularity and expansion. Hypercellularity. When the deposits are in the mesangium, it's not that big of a deal. It's literally just a connective tissue. So you're not going to get that active of a urine sediment. You're not going to get like complement activation, for example. And these patients tend to do relatively well compared to the other classes. So what about classes 3 and 4? That's actually a lot worse. This is where your immune deposits deposit inside of your capillary, right up against the bloodstream. So when the deposits are on the inside of the capillary, that's called subendothelial deposits. So it's like inside the capillary, endo inside the capillary. Subendothelial. Because it's right up by the bloodstream, you get a lot more of an active urine sediment. So you get a lot more red blood cells, red blood cell counts, dysmorphic RBCs, for example, and you get activation of the complements as well, since the complements are in the bloodstream. So you get low complements here. So low C3, C4, more active urine sediment. This is definitely a worse lupus nephritis to have. When you have class 3 and class 4, you really have to consider doing intensive immunosuppressive therapy, which we could maybe talk about in another video in terms of the different regimens that you can try. So what's the difference between 3 and 4? With 3, is just that it's less than 50% of the glomeruli that are affected, and with class 4, it's more than 50%. So not that big of a difference. I mean, not that hard to distinguish. Unless you're the pathologist reading it and you're like, I don't know if this person only gave me like 3 glomeruli. I don't know if like 1.5 glomeruli really counts as class 3 or class 4. So classes 3 and class 4, deposits inside the capillary. What about class 5? Here, the deposits are right on the outside of the capillary. What's that called? What's that area called where it's right outside? Instead of subendothelial deposits right on the inside, it's now subepithelials right on the outside of the capillary loop. So subepithelial deposits. So remember on like microscopy, you can't see deposits and just a reaction to your deposits. So here what you'll end up seeing is growth of your basement membrane growth of your glomerular basement membrane between the deposits that you have. That's what you can see on your electron microscopy. You can see this. What that's called is a subepithelial spike. It's essentially trying to heal itself. So remember, this is actually, does this sound a little bit like a glomerular disease you may or may not have already heard of? This is membranous nephropathy. All this is membranous nephropathy. You get immune deposits right on the outside of the capillary. You get healing between the deposits. These immune complex deposits might not just be lupus deposits. It could be, for example, PLA2R deposits in membranous nephropathy. It could also be, for example, the hepatitis B E antigens that are on the outside as well. So this is really just a membranous nephropathy. Remember, membranous nephropathy is a proteinuric disease. So you get a lot of protein, you don't really get much RBCs in the urine. So subepithelial deposits in class, where's my black? And this, because you're not getting the deposits on the inside of the capillaries, you're not really going to get complement activation. It's not that active of a urine sediment. You're not really going to get much RBCs. Some people argue that you don't really have to do immunosuppression for class 5 by itself. Some people argue that maybe these patients do end up progressing to end-stage renal disease. There's a few people that say like maybe we should actually treat them just as aggressively, but currently the guidelines are just like if you're class 3 or class 4, immunosuppress. Class 5 by itself, not necessarily. You can have more than one class at the same time. So you will see patients who have class 3 and class 5 at the same time, or class 4 and class 5 at the same time. Those patients you treat as class 3 and class 4. And you just say, okay, there's also a class 5 too. What about the last class of lupus nephritis? Because we kind of ran out of locations for your immune deposit. You're like, where's the last place that the immune complexes could be? Well, with class 6, this is really sad. Your glomerulus is just done. Your glomerulus is sclerosed. So this is advanced sclerosis. This isn't good. This is past the point of any kind of treatment. It's all just scarred. So that's your 6 classes of lupus nephritis. Remember, with class 1 and class 2, you have mesangial deposits inside this connective tissue. Not that big of a deal. It causes a little bit of mesangial proliferation, if anything, in class 2. Classes 3 and class 4, that's bad. The deposits right up against that bloodstream, subendothelial deposits. You get complement activation. Only difference between 3 and 4 is how many of the glomeruli are affected, less than 50% versus more than 50%. Class 5, that's where you actually get the deposits on the outside of the glomeruli, subepithelial deposits, and that's a membranous nephropathy. And class 6, you're done. Hope that helps. Thanks.